Case number 6 was the superficial bladder tumour from the male of 65, and this is a nephrogenic adenoma. And here is a really useful stain for confirming the diagnosis of nephrogenic adenoma, and this is the PAX8. Case number 7 was the female of 53 with multiple red areas in the bladder, and this is malakoplakia. Here is a von Gosser stain, nicely demonstrating the Michaelis-Gutmann bodies that are a classical feature of malakoplakia. Case number 8 was the kidney from a female of 35 with tuberous sclerosis, and the renal mass is an angiomyolipoma. Case number 9 was the female of 33 with an abnormal bladder mucosa, and the resection shows endometriosis. Case number 10 was the 21-year-old with a testicular mass, and the clue is in the age of the patient, he is young, and also the LDH that is raised, the AFP that is raised, and the beta-HCG that is raised, and this is an embryonal carcinoma.